I'm so happy first of all that we did this because it's been quite some time. We both had kids at the same time, so we were MIA for quite some time. How is your baby?
He's amazing. We woke him up right now, gave him a little milk. He's fantastic. He's walking like a drunk and babbling like a drunk. So he's definitely perfect. And yours and your son?
He's good. He's a year now, so it's it passed so fast. Honestly, it's just such a blessing to have two boys. There's nothing more joyful in the world than having kids. Honestly,
I mean, I obviously had my kids quite late, so I had my kids now, and I'm almost 50. It's extraordinary how long I waited to have a child, and how much more spectacular it is than I had anticipated. You can tell people about it, but you just can't experience it until you have your own. So
I had my kid at 38, and I'm 39 now. So honestly, for the Middle East, it's quite late. So this is my second. Yeah, I didn't get married young. I got married at 32. And yeah, but it's you appreciate it more when you get older.
For sure. Absolutely.
I was telling my followers on Snapchat as well, because Snapchat is pretty big here, and on Instagram, that, as you know, like I'm really glad, first of all, that you gave us the time. I know you have a very busy schedule to be on my Instagram and this live, as a form of being, like, to be informative. And also I've been really watching your interviews and a lot of the things you talk about, which is really interesting. So I want to start off by, first of all, you telling the followers what you do, how you got into this business, how you wanted to be a doctor. Let's start with that first.
Sure. I am now almost 20 years in private practice. I do pretty much a full cosmetic bandwidth. In other words, I do from head to toe. I've been in Beverly Hills my whole life. I actually went to high school down the street from my office. My office is actually, you can see my high school from my office. So to say I've stayed locally is an understatement. And, I always wanted to be an architect. The truth of the matter is I wanted to be an architect. I wanted to be, and I don't know to say an interior designer, but I wanted to go into spatial planning, and I wanted to go into something that had a design element to it. But you know how it is. You're young. You speak to a few people. I spoke to a few architects. They said, don't do it. It's horrible. It's going to be the worst thing in your life. You speak to the wrong people. Next thing you know, you decide not to do something. And then I was in college, and I was always pretty good at science, and I loved design. And then I stumbled across a plastic surgeon who at the time was like the Michael Jordan of plastic surgeons. And I went into the operating room with him one time. He actually was doing a rhinoplasty, which is my favorite procedure to do now. And my head just exploded. I was just like, what? Are you kidding me? You just open this person's nose and rearrange it? That's insane. And that was it. After that, I was hooked. I've been in practice now doing the gamut. When I first went into practice, there was a lot of pressure that you have to specialize. You have to be a specialist.
Yeah, and I hear that a lot.
And I was thinking to myself, I am a specialist. I specialize in cosmetic surgery. When we train as plastic surgeons, we train in breast reconstruction, burn surgery, craniofacial, hand, microsurgery. Our training is 6, 7, 8 years, and it's quite extensive. A small portion of that is cosmetic surgery. So, for me, as a person who's pretty academic, there's no way I was going to come out of training and come in like, I only do right ears. What about the left ear? No, I don't do the left ear. I only do the right ear. I specialize. For me, the entire gamut of plastic surgery, cosmetic, is fascinating and interesting. I love noses, for example, but if I did a nose Monday, Tuesday, Wednesday, Thursday, Friday, I'd kill myself.
It gets boring. But I wanted to ask you the question about nose rhinoplasty. In one of your interviews, you said most surgeons do reductive rhinoplasties, and that you do something called reconstructive rhinoplasty, because the nose, after a while, when can collapse and can be very narrow, and that you use a lot of cartilage for the nose to maintain its form over years. And you said there was something you actually said that you need to avoid 5 things in a bad nose job, which is the scoop and a couple of other things. And everything you said in that interview is something I see day to day from people I know, that after years of doing a nose job, the nose starts changing its form and they have a lot of issues. So tell us about this in detail, please.
Okay. Well, first of all, I'm actually quite impressed that you did your homework and you
I
read
do.
the interviews, and that actually says a
I
lot
enjoy
about
this,
your,
by the way. This
that
is
that says
why.
a lot about your content. Your listeners and your viewers must be impressed, because that's actually quite impressive. So, for example, I'm Middle Eastern. I'm Iranian. I'm from Iran, and so having your nose job is a rite of passage. My mom had her nose done 60 years ago. My sister had her nose done 35 years ago. I did the noses of all three of my nieces. So it's quite common in the Middle Eastern
Yeah.
culture to have your nose done. And so, I was in high school and I was looking at all the girls who were having their noses done, and they were all kind of looking the same. And over the next few years, we went to college, and then all of a sudden, they all had the same issues. And only when I became a physician or a plastic surgeon did I realize, what is going on? So to describe it, you said it right on the money. So there's traditional rhinoplasty. And by traditional, I don't mean it was done many years ago, because it's being done right now in Iran. For example, it's quite common. There's a guy on Instagram, he posted that he does 8 rhinoplasties in a day. You know how fast you have to do a rhinoplasty to do 8 in a day? At best, you can do 2. If you're really slick, maybe 3, if you do it correctly. So what they do is they go into a nose, it's big. Imagine I'm a girl, and I say, listen, it's just too big. So I remove the bone. I remove the cartilage. I remove this cartilage. I remove that cartilage. I sew this together. I break this bone. I rotate it up, and I sew it together. So everything I just did was make my nose smaller by virtue of removing things. So you go into a building and you remove 46% of the pillars. You go into a bridge and you remove 12% of the cables. And you wouldn't be shocked if over 2, 3, 6, 8 years, that building and or bridge suddenly started to kind of collapse. And so the nose is no different. And what you'll notice is that noses that are done over years all look the same. Right here in the middle, they start to get narrow. That is the reason why those people can't breathe, because when you go to breathe, you go, and then this area, which is called the valve, is collapsed. Next, the tip you're trying to do, you're working so hard to make this small, so you remove all this extra cartilage. You see how round it is? But you don't support anything, and these nostrils start to get narrow and narrow, and you see this isolated ball, right? And these areas start going in. Then you can't breathe from underneath.
Okay.
The nose is highly rotated. This portion becomes scooped. So if you look at a sort of quintessential nose, one that's been done, and there's hundreds and hundreds of examples in everyone's family, they all look the same and they have the same. So modern day rhinoplasty, something we learned maybe 20 years ago, is, okay, let's make the nose small, but we know this is going to go in. So we should put cartilage right across here. We know this is going to go in, so we should put cartilage here. And all that cartilage structure support comes from your septum.
Yeah.
So you do a breathing surgery, make your nose breathe well, and at the same time, you take that cartilage, recycle it, and put it back in the nose. And as a result, the nose may be slightly larger at the beginning, which is, oh no. But 5 years, 8 years, 12 years, 23 years later, your nose isn't some little tiny little bird beak with which you can't breathe. And there are many such examples. So that is the distinction between the two types of rhinoplasties.
And it's true anyways that the nose there are 2 parts of the body that keep growing, which is the nose and your ears. So as you get older anyways, even if it actually causes more problems, I hear.
For sure. Absolutely.
Another thing I also loved, like you're so against Brazil, this is a new thing, as you know, since the Kardashians, which is the Brazilian butt lift. And I know that you're not very into that, although this is like the new it thing in most of parts of the world, like Florida, like parts of the Middle East. Like this is the new form of the beautiful female body. So you were saying in one of your interviews as well that you're not a fan, and that injecting fat into the muscle is usually a given because it's a large vessel. But in the future, this could cause really big problems because it actually can be a blood clot, and that it's very dangerous. In addition to the fact that you were saying that it's not something that you recommend on a long-term basis. So tell us more about this, because this is something that's becoming like, let me go get some fillers, let me get some Botox, let's go get a big butt, which is, I think, also being the right candidate for it is something. So let's talk about this whole process.
Perfect. So BBLs is, as you said, a super hot topic and has been for probably about 4 or 5 years. Absolutely, like most trends, certain celebrities trigger it, and the Kardashians are definitely the ones who were sort of the driving force behind the BBL phenomenon. And what it did is it opened up the world for full-figured women. High five. Love it. I love that the world went from the 90s where you had to be cocaine chic, you know, skinny cocaine chic, to like, hey, why don't we embrace
that?
Right. My wife loves that. My wife is an ex-model. She loves cocaine chic.
Me too.
Some people love curvy. All good. Apples, oranges. So the fact that we started to embrace the full-figured woman in our aesthetic, you know, paradigm is awesome. The problem was that we're now obtaining it through this procedure called the BBL. So here are the issues that I have with BBL. First of all, if somebody has a very small butt or is not desirable for them and they want to enhance it, in and of itself, I don't have an issue with that. Just like if you have small breasts, you want to enhance it, great. The problem is the procedure in and of itself is flawed. And here's how. Number one main issue is that when you want to add fat to anywhere in the body, under this hollow in my eye, in the midface of my face, in my breast, in my butt, you have to take it from somewhere. You must steal the fat. Now, inherently, you think, holy shit, this is amazing. It's a win-win. I get liposuction, awesome. And then I transfer that fat into some other area, awesome plus. The problem is that the amount of fat that you need to make a difference in the breast and in the butt is substantially larger than in the face. And when you go to borrow that fat, steal it, you
said stealing from Paul to pay Peter. That was
you are brilliant. Paul and Peter are best friends, and you're stealing from Paul to pay Peter because you don't understand how liposuction works. The number one complication in my practice that I see over and over and over again is women who had massive liposuction, BBL, their stomach, whatever, 2, 3, 4 years later coming in with all kinds of loose skin and divots and dents. So when you go to steal from Paul, you need a lot of fat to make a difference for a butt. You can't put in 100 cc's. You got to put in 5, 6, 7, 1,000 cc's. Remember, half of the fat you transfer dies. So you need a lot of it. So what do? You do 360 lipo. Oh my God, that's amazing. You lipo the arms, you lipo the back, you lipo the lower back, you lipo the inner thighs, the abdomen. So you transfer that on the butt, and let's just say hypothetically your butt looks amazing. In exchange, over the next 18 months, every area you borrowed fat because the surgeon was very aggressive starts to become weird and like loose. And then there's a dent here and a divot there. Why don't you stand in front of overhead lighting? But I don't see that on Instagram. Yeah, because there's filters, because they're in overhead, they're in flash photography. They're taking the photographs within 2 months. 2 months, your butt looks amazing and your thighs look fine. Talk to me in 2 years. So the number one reason I hate fat transfer in large volume is that I'm creating a problem to fix a problem, and the problem I'm creating looks like shit. No woman looks good with loose skin, dents and divots. I assure you 100% any type of aggressive liposuction leads to that. That's number one. The bigger issue is, just yesterday, my team sent me an article. Yet another woman died in Miami.
Again.
Women, we've never had a procedure in plastic surgery, ever, that so many people died. You don't die from rhinoplasty. You don't die from breast aug. You don't die from facelift. Women are dying left, right, and center. And why they're dying is because this procedure goes as follows. You take fat, and then you stick it into the butt, and you push it in. And when you push that fat in, there are huge vessels, big veins. And many times the surgeon punctures the vessel and shoves the fat into the vessel while they're trying to put it in your butt. They can't see it. It's blind. And that fat runs all the way through your heart and into your lungs. And you get an embolus, something you would get from blood, except now you get it from fat. And it's almost immediately fatal. So when 30 women die in Miami because of this procedure, it's kind of crazy when you think about that. That's like become this trend. So I'm not opposed to big butts. I don't care if you like big butts. That's your favorite. Awesome. I don't love any large volume fat transfer because I'm not going to steal money out of your account to put it in your sister's account. Now you're poor and she's rich. And I don't want to do a procedure that has a very high risk of mortality. So that's why I'm opposed to it. The last thing is you're finding women who needs a BBL? Mostly skinny women, right? If you're full figured, usually you have a big butt. So the worst candidate are the people who don't have a butt because they have no fat.
Exactly. And how much are you going to remove from every other area? If you liposuck her whole body, it won't be enough to fill.
Right.
You know what I mean?
And then what happens is you do it, the butt looks good for like 3 months. You're like, well, I guess it was worth it. Then that fat disappears because it's so little. And then you're left with this incredible damage that can never be fixed in your arms, in your belly, in your back, etc. So that's the reason I'm anti-BBL. And I think that procedure is not going to get any better.
No, I agree with you on that. I'm not a fan of BBL as well. Also, I'm a full-figured woman, but I don't understand why would women go overboard. I just find it. I think you should just work on what you have and make the best out of it. Just don't.
The reason people go overboard is because the nature of everything that we do is to not know where our limit is. So look at the lips that are being created. A little bit of volume, beautiful.
True.
Too much volume, ridiculous. A little volume in the mid-face, beautiful. Too much volume, Catwoman. A nicely reduced nose, elegant. Overly done. The problem is that you are relying on this vast majority of practitioners, doctors, plastic surgeons, ENTs, dermatologists, nurses, to provide the endpoint. And the reality is that they have a skewed sense. And so patients are just this canvas of outcomes that are shitty. So.
I want to ask you, since you are very good with rhinoplasties as well, you know there's a lot of people that do non-invasive procedures with the nose, like fillers, threads. I personally want to know your opinion. I know in the States, most people are very against threads for the nose. There's two schools, like the European school is very pro-threads, the American school is very against threads. I want your honest opinion about like temporary solutions with the fillers and threads for the nose. What do you think of that?
So I think they're twofold. Number one, I'm in general not a huge fan of putting too much in your nose. This is a very delicate structure. You see how much space you have here? You see this tissue? So even if someone doesn't mistake and they make an error, number one, it's forgiving. Number two, there's a lot of blood supply here. Noses are very delicate. You can create so much irreversible damage, necrosis of the tip, ischemia of the nose, blindness in the eye through the nose. So injecting temporary things in the face versus the nose in and of itself is very dangerous. And the people who are injecting are not well trained. Let's be honest. You go to a spa, Julie is injecting you. Julie looks like a duck herself, and she's injecting you, and she's a world-renowned Instagram injector.
Yeah. I know. I see this a lot. This is
who the hell is Julie? Where did Julie go to school? Where's Julie's training? So filler in the nose, I do very judiciously. There are things that the nose can tolerate. Filling in the hump, very well done. Loose skin, therefore it reacts. Trying to make your nose up, forward, and sharp by shoving fillers in this area that's really tight is not ideal. It causes a ton of inflammation. Then you go and want to do your nose at some point. Then you got to go reverse all that. Now you have a boatload of scar tissue in your nose. So I'm okay with fillers. I love fillers in the right place. I hate threads. And the reason is threads are always super temporary. You put threads here, you lock them in, and then you pull, and it looks great for the party, and then they start to settle. Now you have all these threads in your face. Oh, they're going to absorb. How do things absorb? Through inflammation. That's how things absorb. That's how sutures absorb. And then one day you're going to be like, shit, I need a facelift. And you're going to go in there, and that surgeon's going to have to go through all that junk. So, and also the last reason why I hate temporary fixes, this is probably the main reason, is when you have a surgical outcome, you need to go see a surgeon. And while not all surgeons are great, they're generally decently trained. When you do temporary treatments, you go to any asshole, any clinic, anywhere. And the amount of training that you get for temporary is 1/90th that of something permanent. So the danger of the threads is they're falling in the hands of beauticians, cosmetologists, pediatricians, nurses. It becomes super dangerous because now you've given the green light to all these people to do things, dentists. So I don't know. I find plastic surgery still very sacred. I feel like you wouldn't go and get your gallbladder out by anyone. You wouldn't go get your baby delivered by anyone. But plastic surgery, because it's cosmetic, has opened up the door to too many people. And a lot of the bad outcomes are because people are not trained.
I agree with you. And I really like that you also said in one of your interviews as well, aside from another thing, are you pro fillers in the face, or do you like it in very minimal ways?
Yeah, listen, I do all my own injectables. 99% of my colleagues who are busy have nurses that inject. I chose never to do that because even though it would generate much more revenue, like I don't have time to do injections, but I do them judiciously. I love them in the right patient. I use cannulas. I'm very careful. I know the anatomy. But because it's not my livelihood, I don't make a living from filler. I could care less if you put 1 syringe or 7 syringes. I'm not biased, so I do it elegantly. You go to a nurse injector, she makes a living from 1 to 2 to 3 syringes. So don't be surprised you walked out with 3 syringes.
And then she charges you 10 times the price because you're like, we use so much, so we had to use this. So this is why the bill is way higher. I know the drill.
It's a big scam, in my opinion. But so I like it. I just like it carefully.
Another thing, there's a theory, because in our part of the world and in many parts of the world, they always say that filler lifts. On the other hand, filler just fills. It doesn't actually lift your face. What's your theory about that filler moves over time and then you get that kind of like pillow face after a while? So is it true that you should just always inject fillers on muscle areas and not on areas in the middle or stuff like that? I just want to know because everybody has different theories on this.
So I think your analysis is actually right on the money. The truth of the matter is the only reason filler lifts, people love these theoretical concepts and then they sell them to patients. So the idea is I'm beginning to jowl. So I don't want a mini facelift, which is the right treatment. Wow, that looks spectacular. Instead, I'm afraid, I don't want blah, blah, blah. I'm going to go to the gal. She's going to put filler here and it's going to lift this for me temporarily. The only reason these things exist are because we're trying to sell patients on concepts. So let's say you got stung by a bee. And this swelled up like a balloon. Yes, it's lifting your face. But it requires so much volume to lift. Otherwise, you're adding volume. And so many times you see people that look heavy with filler in.
True.
So when filler is placed judiciously and accurately, let's take my face, for example, which is a disaster.
Oh.
I have hollow under my eyes. I should get my eyelids done. I don't want to. Tiny amount of filler under the eye, but the right type. If you use Juvederm here, it's going to turn into a balloon. You use Restylane here, it'll stay small. My mid-face is a little hollow, even though I'm a male. Tiny amount of filler will make this smooth and improve. This area is hollow. Never touch it. Never. Yeah. Never. Because it looks like this.
Yeah. I really also don't like when people get a filler here, they suddenly start becoming very big in this area.
The only area you feel, the reason this hollows is because this is emptying. This empties, this pushes down. I've never injected the nasolabial fold, ever. Marionettes, slightly along the bone, a little bit. People fill this, they need a facelift. They fill this area and fill it, and next thing you know, you look at them and they're this wide.
Yeah.
So filler is a nice little, think of it as a very small paste. People are using it way too aggressively, trying to undo things that can only be fixed surgically. If my eyebrow is here, no Botox is going to make it look like this.
Sure.
So you use filler and Botox and these lasers as interim things when you're not quite yet there surgically. But the problem is that you're going to one of these spots. They're not going to let go of you. They're not going to release you. The answer is, sweetheart, I can't help you anymore. It's time for you to get surgery. You have too much filler in your face. Anymore, you're going to look bad. This needs to be lifted. It's time. And then they hand you over to the next person, but they won't release you because they're going to lose revenue, and they're going to keep injecting you until someone says, wow, you look really weird. You understand? It's slow.
And it's actually a very profitable business sometimes. Like when you do one surgery, you'll get the patient way less. But when you do fillers, she's going to be coming every couple of months. You make more money.
100%. And if you have a recurring revenue stream, it's, you know, I'll operate on someone. For example, I do a rhinoplasty on a 23-year-old. I may never see her again.
Exactly. It's
right. But if I'm doing, like you said, injectables, I know for a fact you're coming in 3 times a year, guaranteed. And while you're there, oh, by the way, I bought this new machine. It's going to tighten your skin. Really? Yeah, I'll do it for half for you. And you see that brown spot? Next thing you know, you walked in there for, I don't know, 20 units of Botox. And next thing you know, you just spent $4,500 on a bunch of stupid machines. Okay. Then you go and you have to squint your eyes and go, I think it worked.
Okay. I want your honest opinion about machines now, because like I don't do fillers. I just do Botox mainly, and I want to know honestly. I haven't done anything surgically to my face, but I love machines. So tell me the honest opinion now. I'm going to tell you the 3 machines that are so used in our part of the world: Morphus,
okay.
Scarlett, Ulthera, and EM Sculpt. I want to know your honest opinion about those 4.
So let me preface it this way. Number 1, it's all about what's being sold as the end result. Mm-hmm. So I have only 2 machines in my office, and I wish I never bought them. Now I can make a boatload of money if I buy all the machines you mentioned and then some. I have a captive audience. They trust me. They come through my office. They're in my office, and I just funnel them down these paths and have nurse practitioners who do all these procedures. So obviously, and don't get me wrong, I have a son and I could use the money. But the reality is that I want to do something that I know. I like results that are like, oh shit, that looks great. So my feeling on machines in general is the results are mostly super subtle. Now, if that's what was told to you, and that's what you spend all your money on, was for subtle improvement, high five. But that's not what's sold to you. That's not why you paid $5,500 or some crazy ass amount of money. And then you expect or wish that it would really do that.
No, it doesn't do that.
It's not going to even come close to that. So that's my general gripe with machines. Most of them don't work and some of them do. And the ones that do work subtly. Now, resurfacing skin, only lasers can do that. I can't resurface your skin surgically. I can't make this seam a little smoother. No problem. Fractionated CO2. CO2 is a technology from 30 years ago. Burning your face off. That shit works. Now, the problem with it was that it had a lot of downsides, especially in dark-skinned people. Yeah. So they came up with technology that made it fractionated. So it wasn't 100% CO2. It was partial. Wonderful. Brown spots and solar changes. I can't change that. You need to do some type of IPL or light-based laser. And then you need to maintain that with a decent skin regimen. If you go back into the Saudi sun, you're going to be right back where you were, arguably worse. Now your skin is inflamed from the procedures and it's really sensitive to sun. The tightening machines, all of them, every one of them don't work. All machines that claim to tighten skin do not work, including all therapy. The 1 of 2 machines that I bought. I bought 2 machines. One is Cool Sculpting and one is all therapy. The reason I bought all therapy is I have many patients between 38 and 50. And between 38 and 50, you're just starting to gel.
Here.
You're just starting to marionette. you just starting to get, this is a little loose.
True. So true.
Just,
oh my God, you got the exact points that bother me at this point.
Just starting. It's not terrible. You're not 60, but they're beginning. And you come to me and you want help with that. And you can do a little filler and a little la, 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 but it's not going to, what you're doing is this is starting to descend. And the treatment for it is to elevate it. But at 40, it's too early for a mini facelift. It's just too early. So I purchased this machine in hopes, and I bought this like 15 years ago, like that when I was an idiot. In hopes that this machine, in hopes that this machine would, in those patients, help lift just a little bit, and it doesn't. And what it does is, it turned out that if you have a skinny face like me, it melts the fat. And there are many people who did all therapy and had horrible hollowing. It works well in fat-faced people, full-faced people, because it helps sculpt their face, which is accidental, which is not what it was intended to do. It's intended to go to the muscle, heat the muscle through the ultrasound. The muscle tightens and you get a lift. It's bullshit. It doesn't do that. What it does is, as the energy penetrates, it's going through your fat. Your fat is super sensitive and the fat starts to melt. If you have a full face, you start to see some stuff. Oh my God, it's lifting. If you have a skinny face, you start to get hollowing. And that was all therapy. And that was the machine that was, all other machines that are designed to lift don't work. Trust me, if I find a machine that lifts, I'm done. It's over. Game over. 10 of those machines, 10 nurses, all the rooms. I'm going to lift your arms, the saggy arms. I'm going to lift your neck. I'm going to lift your eyebrows. This shit doesn't work. So we don't have a machine that lifts anything. It's the holy grail of plastic surgery. 90% of what we're doing is lifting your breast, tightening your abdomen, tightening your inner thigh. Just imagine the power of it. We wouldn't be keeping it a secret.
Of course. Why would you do something surgical if you can actually have an alternative?
Right. So that's my thoughts on that one. Fat melting machines, whatever, Cool Sculpting, and there's hundreds of them. They work somewhat. The Cool Sculpting definitely works. It's good for little areas of fat that you're trying to get rid of. It's not good in skinny people because you really don't have fat, you have skin. And it's very mild at best. The reason I got that machine is because I don't like to do lipo in people with a little bit of fat, because it creates a little bit of looseness, because the machine has to go, when you liposuction, you are disconnecting. Mm-hmm. As you're removing the fat, you're disconnecting the skin from the muscle.
What about people that are like, for example, someone like me? Like, I do have fat. I have 2 kids. I'm above my weight by at least 6 kilos. Like, we talk kilos, not pounds. But so there are areas that I feel like I could do some lipo. But then again, everybody talks about 2 things after lipo, that the fat distribution changes, because the areas where you actually do the lipo, the fat is actually destroyed and you kill the fat cells. So the fat goes somewhere else and the accumulation goes to somewhere else. So who is a candidate for lipo? Like, there are people that have certain stubborn areas between the thighs and the arms, like this part here. Like after kids, like maybe you don't even have a saggy stomach for a mommy makeover, but you have extra fat. Is this type of candidate, like am I a candidate? I don't think I need a tummy tuck, but then again, there's that excess skin. Who is your ideal candidate for like a 360 lipo, you say?
Okay, so here's the thought process. So this is the deal. Number one, every month, there's a new type of liposuction. There's a new type. Slim lipo, smart lipo, laser lipo, ultrasound lipo, tickle me lipo, right? Why are there new types of liposuction every month? Because they're trying to reinvent the same shitty procedure. So listen to me carefully. I don't care what technology your doctor uses. They're all the same caca. You make a hole, you use a long straw with an opening at the end of it. And you go in and you pluck fat out. You're plucking it out. You're not cutting it out. You're not shaving it off. You're plucking out fat, okay? And when you pluck out fat, when you're in the operating room, you see little things come out with it called connective tissue. So your skin, your beautiful, tight skin, is attached to your muscle by little cables. That's called septae. They're little connections between your skin and your muscle. Go to your child, grab your child's arm or belly, and notice it's stiff. It doesn't move. Grab the skin of your abdomen, and you'll see that it moves. Those septae have been stretched. When you liposuction, amongst the little plucks of fat, pluck, 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 you're pulling out these septae accidentally, right?
Mm-hmm.
And so what you're creating, I just want you to understand what we're doing, and then I'll tell you who's a candidate.
Yeah,
What you're creating is this uneven bed of fat, right? No one in the world's greatest liposuction surgeon to walk the planet, can go in with a straw and remove fat in a perfect plane. Can you make a perfectly smooth street with cobblestone? Can you build a street with bricks and make it smooth? No. So you can't remove fat one by one and expect that when it's done, that what's left is smooth. Correct?
Yeah, correct.
So 100% of patients have some undulation, some waviness to them. Now, if you have amazing skin, it will not show as much. And if you have kind of loose skin, it will show more. But no one doesn't have the undulations.
Is this what causes like the dents on the skin? Like
correct,
again,
correct,
correct.
You get rippling, you get divots, you get dents. Now, that's issue one. 100% of patients who get liposuction get divots, dents. The second is, depending on the quality of your skin, what you're praying for as a surgeon is for me to suck out the fat and for your skin to snap back and squeeze over the new shape. So I have a pillow and a pillowcase. I go in and I take your pillow out and I put a smaller pillow in. Same pillowcase. You hope that the pillowcase is elastic and will shrink over the new pillow, which is smaller, but it doesn't. There's redundancy. So the problem with liposuction in every patient in the universe is one, it leaves irregularities. Two, the skin doesn't snap back sufficiently. Now, to answer your question, the only people that are candidates are people with super tight skin, AKA not a mom who had 2 kids whose skin is soft, and people who want just a little bit of fat removed so it doesn't create as much irregularity.
What do you mean by little fat removal? What's
well,
little? Like, for example, this is little?
No, so like, for example, feel your arm right now. No, not your whole arm, not your whole arm, just that little part at the bottom, right here. This part right here, right? This area right here.
Okay.
And you'll see that the skin on you is average. It's not loosey-goosey. You have good skin, I could tell. But it's not as tight as, let's say, someone who is Korean,
obviously.
Latino from El Salvador. Nice, thick. So when I lipo you, your arm, it will get a little bit smaller because the majority of your arm is muscle, right? Yeah. Remember, all you're going after, sorry, I have to hold my hands. No. All you're going after, remember this, oh, my arm is so big, it's so fat, it's so fat. All you're going after is this little shit here. This is all you're going after, this little bit.
Exactly, which I hate, exactly.
Right, but then what you do is you create a whole shit ton of irregularities in exchange. Like, and then what happens, that's right, and then what happens is right now you're wearing a beautiful tank top. You wish your arms were a little skinnier because that's always fun, but you're not embarrassed to wear a tank top. But when you have a dent or a divot or the scar right there is visible, you will hate it. So I'm just anti-lipo, not because I'm like, oh, it's so evil. It's just not a good technology. It's a shitty technology. And so what they're doing every time they introduce a new liposuction is trying to figure out how to fix the problems. The problems are the irregularities and the loose skin. So all the new technologies have some type of heat associated with it. Heat. Before it was just, what's that?
To tighten the skin.
Correct. It don't work.
And it doesn't work.
Not well.
No. Oh, well. So what about you?
I want you to go look at all your friends who had liposuction. Honestly, 1 year out, 1 year, not within 3 months. 3 months they're swollen. None of this shit shows up at 3 months. I want you to walk around, ask your friends candidly, your group of 10 friends who had liposuction, me, ask them if they're more than 18 months, go into a room with overhead lighting and stare at them. And you tell me if they look good.
I've seen it dense and like, you know, it's not equal fat in one area and the other, it's not equal distribution. I see it. Yeah. But what about you when when you do the mommy makeover and you do the boob, the breast lift, and then afterwards you tighten the stomach, you do remove some of the fat with lipo, right? You don't.
Go look at my results. 10% of my patients have a little bit of liposuction in the love handle. I almost never do liposuction with a mommy makeover. Ever. You can go look at my work. It's the muscle tightening. It's narrowing the midline. You want to go to a party tomorrow, right? You want to go to a party. You want to get into a sexy dress. You want to wear an hervé léger dress. You want to be curvy. So you wear a Spanx or a corset or something, a shape binder. And what you're doing is you're tightening the middle of your abdomen by cinching it in here.
The middle part, yeah.
Right. So when I do, most surgeons liposuction your love handles to create a curve by force. Then they leave you with a shelf effect, and then loose skin. I'm very conscientious about the muscle closure. And when I close the middle, I'm cinching your waist. Then the skin that I remove has fat in it. That goes in the trash, but I don't suck it out. Then when you tighten skin, I guarantee you right now, 2 children, you look fantastic. I guarantee you have loose skin. And I guarantee you that if you put your hands right now, if you take your hands and you do this.
Where? Where do what?
Watch. If you go like this, which you're not, and you pull up on your belly, you see that shift? Yeah. So now don't do anything. Okay? Now you go like this and you go, look, Dr. Rahban, look at this fat. Can you lipo this? I hate this fat, right? Yeah. Now I want you to pull your stomach up and with one hand try to pinch that fat now. Pull.
Nothing.
There's nothing there. The reason you have fat is because you have skin that's duplicating on itself. So they'll liposuction you. Actually, you're in the 90th percentile, 2 beautiful kids, you work out every day, you're in good shape, you have a little bit of loose skin, you don't love it, you'll get liposuction and you'll go to shit. Because your skin that's a little loose, that's at least got fat in it, and it looks smooth, will start to get irregular. Then you 100% will need an abdominoplasty. I do these like...
Do you recommend the mommy makeover more like with such a situation, for example, like someone that has a mild, like it's not so tight and some extra skin, more than the lipo? Like, would you recommend the mommy makeover, the boobs?
Listen to me. I never liposuction a woman who's had 2 or more kids with a loose abdomen. It always gets looser. You're starting with the problem. The problem is my skin's been stretched. Mild. And I'm going to then remove the thing that's keeping it looking great. When you lose weight, if you lost 30 kilos, your skin would be loose everywhere.
True.
So it doesn't matter if you lose the weight or I suck it out. The fact of the matter is, removing fat aggressively leads to 1,000 problems in the overwhelming majority of people. The end.
Another thing I want to ask you now, because you're a pro in this, the mommy makeover.
Yeah.
A lot of people come to you, of course, when they think of a boob lift, they think that there are a lot of women that do not look at the consequences of how the scar would look. Oh. This is something we all have in mind. I'm going to get a boob lift, but they don't know how big would the scar be, how will they dress again. So tell us about how you address each candidate according to like how much she needs lifted. Okay. Do you cut from one area or you have a specific way? Tell us, please.
So breasts and moms. So 2 things make up a beautiful breast. You look at your old breast before you had kids, before you breastfed, or you go on and you open a magazine and you're like, wow, she has such beautiful breasts. 2 things make breasts: shape, size. Shape and size. Shape refers to having upper pole fullness, having a round breast, not touching your chest and being elevated. A smaller areola that's in the middle of your breast, not at the bottom. Beautiful cleavage that isn't long. There are things that make up a youthful breast, that of a 20-year-old before I had babies. You give birth, the upper pole empties, this area gets hollow, the nipples start to sort of head downwards, you start having contact between your chest and breast. Those are the things that change. That's shape. And volume is, I used to be a full C, now I'm an A. That's volume.
What if
I
it's
used
the
to be
opposite? There are women that become bigger after
yes.
kids.
I used to be a nice C, and now I'm a full D. So 80% of women with babies lose breast tissue. 20% of patients gain breast tissue. Okay? So we've established what our goals are. Our goals are a beautiful shape and the right size. I'm happy, Dr. Rahban. So from a size standpoint, you either have to add volume, like I'm hollow, I'm empty, I don't have enough breast tissue. Can you just do a breast lift and no implant? No, you don't have enough volume. You have to add volume. The volume is added vis-a-vis an implant. Some people want to do fat transfer. I just gave you a whole lecture on why I don't agree. And if it's too large, then the answer is I got to remove breast tissue. I got to reduce it. So size is straightforward. I either have enough breast tissue of my own, I don't have enough breast tissue, or I have too much breast tissue. So from a size standpoint, we add an implant, remove breast tissue, or just keep your own breast tissue. From a shape standpoint, if your breasts are sagging, not they're just empty, I just lost breast volume, I add an implant, straightforward. They're sagging, you're going to need a lift. Now, lifts come in three flavors. Three flavors meaning there are three types of lift. The types of lifts are not ones we choose. They're the types of lifts that are selected for you based on how much sag you have. You have mild sag, moderate sag, and severe sag. And so naturally the incisions or the scars become greater because we need to remove more skin. You have a donut, goes around the areola. The whole procedure is done through there. That represents 5% of patients, almost never. It's a shitty lift. Why? Because all you're doing is removing a little bit of skin around the areola, and all it's going to do is squeeze your nipple and make it go back. It's not a real lift. It's a fake lift. It's only designed in women who have just ever so slight sag and are going to put volume in. When you have a little bit of sag and you add volume, you can get away with a donut. The next is a lollipop around the areola and down, around the areola and down the breast. And the last is around the areola, down the breast, and in the fold called an anchor. 75% of all lifts, and this is my bread and butter, and I do hundreds of these, require an anchor. You need an anchor to get that, wow, you have such beautiful shaped breast. You never, ever want to do a lesser lift in fear of scars or whatever, because then you'll have a shitty outcome. Now, scars are not ideal, but if they're closed well, so this is my big, like this is where 90% of surgeons that are busy, like busy practices, do not close their own incisions. They don't. Do you know lawyers that do all their busy work? They have paralegals. All the dentists I know have hygienists, and every lawyer, every doctor I know has a nurse practitioner or a PA or a tech. They get everything set up, staple, tummy tuck stapled, and then the nurse or the PA starts to close. Well, where the hell's the doctor? Oh, he's getting the next patient ready in the next room. You got to get going, girl. We got to do 5 cases today. I'm not going to sit there and close all these incisions, the entire anchor and another anchor and then a tummy tuck. Are you kidding me? So where the scar comes from is from that damn closure. It takes me forever to close an anchor and then another anchor and then the whole goddamn stomach, layer by layer by layer, suture by suture by suture. So when you look at the work online and you look at the quality of that scar, it is, yes, a substantial portion of it is the patient's biology, if you're black, if you're white, or whatever, but most of it is shitty or good closure. But the answer is you do not get an anchor because you're afraid of the scar. You just don't get the surgery. You don't say, well, I don't want an anchor, so I'm going to get a donut. Well, that's craziest thing I've ever heard. You need your gallbladder out. Yeah, I don't want a gallbladder out. So can I just do like, maybe take a stone out? No, you need a gallbladder. You wouldn't do that in anything else. So you have 3 types of lifts. And now within those lifts, if you are the 20% where your breasts are too big, you do an anchor reduction.
Okay.
Rather than an anchor lift. Reduction being I do the anchor and I remove breast tissue. Lift is I do the anchor and I use your breast tissue. And then there's anchor where I add breast by doing an implant. So when you look at my work and I do my reductions, I never use an implant. I use that person's entire breast tissue because it's beautiful and thick. It's just a lot of it.
It's very interesting, But I also like the point, like, they always tell you sometimes a lot of doctors become so busy and too busy for their own patients that they lose that nice feel they have with the patient, that they actually become just like very commercial. And I also know a beauty broker. I don't know if you know Melinda. She told me that like after a while, she stops working with all these like star surgeons that are becoming very famous on social media because they lose that sense of touch with the patient and they just become too commercial for their own good. And
yeah, I mean, listen, at the end of the day, that's what it comes down to, right? Because of what we do, listen, let's say I'm Hermes. I'm Hermes, the company, and I have a beautiful bag. I'm Hermes and I can create or decrease, or I can increase or decrease production. The problem with plastic surgery is I am the Picasso. I have to make the thing that I sold you. So if I get really busy, I have to make more of them myself. I can only make so many paintings, right? Mm-hmm. I cannot make more of them because at the end of the day, I'm the one who has to do it. So the only way to make more money when you've maxed out is to start to pass things on to other people to do for you.
No, that doesn't work because when you do a Picasso, you need to finish the job.
Well, you're preaching to the choir. Do you think I want to sit there and close all these patients? Do you know how much arthritis I have in my knuckles? I don't enjoy it. I'm not going to lie to you. I enjoy the outcome. I enjoy the relationship, but I don't enjoy sitting there for 2 hours closing these goddamn wounds. But there's no way in my operating room, there's 5 surgeons and the tech closes for everybody but me. The guy that hands me the instruments, he's the closer for everybody. And he's been working with me for like 15 years. It's just the nature of each person's personality. That's just the way it is.
I want to ask you, doctor, do you do facelifts or it's not your thing?
No, I do facelifts all the time. Of course. I love facelifts.
I'm going to ask you something that every girl my age or like is getting, like I'm 39, but like the majority of women that are in their 40s start getting into this question. You said 40 is too young for a facelift. But the majority of women my age start getting upset. As you said, this area here, they want more like toning around. They want the more lifted eye. And then now you hear a lot of plastic surgeons saying it's not a matter of age. It's a matter of just feeling better. And it's a matter of, it's just a beauty thing that you prefer. They're not looking at age as a way to do a facelift. They're thinking of what you prefer. What is a recommendation do you, because if you do a facelift at 40, you're going to definitely do it again, like probably in 20 years. So what do you recommend for women that are at this age who are not really ready for a facelift, but are annoyed from the sagging or the discomfort they feel like when they walk into a room, they want to kind of look like they're not 40. They want to look like they're 30. So what is the suggestion for that?
So first of all, I do agree that, our concepts of age are somewhat based on culture. It used to be that a facelift, the word facelift was like, oh, like you wouldn't even say the word facelift unless you were above 60. It was an insult. It was an insult. You'd never tell a 52-year-old woman she needs a facelift. She'd punch you in the face. But we have changed that paradigm. And now it's not only an insult, it's kind of sexy. Like I got a mini lift. It's changed the culture. So what it is that I don't have a problem with someone in their, I've done many, and I hate the word mini, and I'll explain you what I mean by that. Many facelifts in women in their 40s, many. So the only difference is that when you're 60, you have a lot of this, a lot of this, and a lot of this. And when you're 46, you have a little of this, a little of this, and a little of this. So then the surgery, which is a facelift is a facelift is a facelift, the difference is the 40-year-old gets this, the 60-year-old gets this. It's the same surgery, but longer because you're removing more skin through the process. So I don't have an issue with that. When I said it's a little early is it depends on what you're treating. When you're like your late 30s and early 40s, I can't speak for everyone. It depends on how your weight was. If you were 220 and now you're 160, you're going to have much more laxity than a normal 38-year-old. But if you've been pretty even keel, you've been 150 pounds mostly your whole life, you got gained 30 pounds for pregnancy, blah, blah, blah. It's unusual for you to develop enough laxity where it warrants this incision. Like if I'm all about trade-off. If this incision, which heals well, gets this kind of effect, then it's worth it because you needed it. But if it's all that for this, well, that's right. So where this works as follows. First thing that changes in a person, first thing that changes is their brow drops. The end. 38 to 42, you're going to notice that your brow was sitting here, and now it's sitting here. So that's straightforward. We do brow lifts in 38-year-olds all day long. It's a small incision in the hairline, right here. The Bella Hadid ponytail lift, blah, 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 nonsense. We're lifting the corner of the eye. You see what happens to the brow?
Yeah, yeah.
Seldom does anybody need this.
Yeah.
Very rarely do I do the one that goes across. That's only in people who have very heavy brows. 90% of people in their early 40s just need a little opening of their eye. Easy. In combination, most 40-year-olds start to develop a little redundancy of eyelid skin. Again, slight. At 40, that's like, wow, that's like magic. Because you open up the eye and you clean up the eyelid, and all of a sudden, that's remarkable. The under eye, 20, 30, 40, it's genetic. You either have the bags or you don't. And when it comes to the under eye, if it's subtle with a little bit of Restylane, you can fill it in. And if it's more moderate or severe, you need to transfer this fat bags into your crease. So young. They have nothing to do with age. Then you get to the mid face, and this is genetics. This is how your anatomy is. Some people are hollow in their mid face. Some people are Russian and have high cheekbones. So manipulation of the mid face elegantly, not just shoving volume in so you look like a balloon. You don't ever want to eliminate this beautiful hollowness. That's sexy. But you can manipulate cheekbones and mid face, can buy you some elevation of this area, and then a little bit of filler along the jawline will buy you time. But if you get to a place where this, and there's three things, a little like you have a band here, then it's time. Then you need a mini lift.
How long does it take the procedure for the brow lift? Does it take a long time?
No, the brow lift is 45 minutes. The upper eyelids is 45 minutes. That's no big deal. The lower eyelid is an hour and a half. The face takes time. The reason the face takes time is as follows. So all face lifts are divided into two main categories. There's skin only. That's the whole lunchtime lift that was advertised for years. You go in, 45 minutes later, you come out, and you literally open from here to here. You open the skin just like a circle, and then you just pull. Just pull the skin, call it a day. While it's okay, it doesn't have as much longevity because we're holding on to the skin, and the skin generally stretches. So there's skin only. And then the other type of facelift is skin and muscle surgery. And that tends to be the equivalent of reductive rhinoplasty versus reconstructive rhinoplasty. It's the solid way to do it. But as always, the right way to do it is more difficult, requires more skill, and so most people try not to do it. When it gets to the muscle, you want to lift the muscle so that you're lifting the skin with the muscle as a sandwich. And you want to put the tension, the weight on the muscle that's thick so that the skin sits beautifully and normally. You don't want to pull the skin to make it look like this. So with the muscle, you can do one of a few things. You can just put sutures in the muscle like you do in a tummy tuck and tighten it. Or if you're elderly and you really need a good facelift, you got to go under the muscle. That's called a dual plane or deep plane facelift.
Okay. That's the classic one, right? That's the classic.
Say again?
That's the classic facelift.
That's
called the
sort of the holy grail. That's the ideal. That's the best facelift. My mom is 60. She wants to get a facelift. It's a dual plane, meaning skin muscle, deep plane, under muscle surgery. The reason why it's risky is there's a bunch of nerves under there, so people want to avoid them. But that's how to get the result. So to answer your question, if a 40-year-old comes to me, 40 maybe not, but let's say 44, 45, and it's starting to hollow and fillers are now going to start looking weird, we're going to make you look bad, then the answer is you do a mini. Now, what changes is the amount of skin you have. A little skin, look, goes away quite quick, easily right here. A lot of skin, I need to make this incision longer. I have to take more skin and hide it. So rather than ending here, it ends here. Rather than ending here, it ends here. So that's the difference between a 40-year-old and a 60-year-old.
Very interesting. But do you come to our part of the world or no?
I came to Dubai. I got a license for a year. I went to Jumeirah Street. What's the street where all the clinics are?
Jumeirah, if I'm not wrong.
Yeah. Listen, Dubai, the Middle East, best hotels, best food, best malls, shitty healthcare. So the problem is, and why
Saudi is actually, to be honest, you were in Dubai, but Saudi is the best healthcare in the Middle East.
I know, but listen to my issue that I have. It's a very, tons of Beverly Hills plastic surgeons have been coming to the Middle East.
Yeah. Providing
what I consider shitty care. The reason is that you go there, I come, and I'm there for, first of all, it has to be worth my while, right? So I work every day at my office here. So why would I get up and leave my office and go there? Let's say, hypothetically, I make 3 times the money. Okay, fine. Then I'm only going to go there for about a week. I'm going to operate like a machine because I got to maximize. So right there, number one, compromise. I'm going to put more cases in than I would normally because I have to make this worth it.
Because of the timing, exactly.
Right. Okay. So just think about that. 2, bye-bye. Where are you going, doctor? I'm going back to Beverly Hills. Good luck. And I hand you over to some whoever. And it's usually a medical doctor or someone. They're certainly not the surgeon. They're gone. Dr. Joe Schmo is gone. What happens in the 10%, 15% complications? It happens. Everybody, all surgeons. Wound infections, necrosis, drains, whatever. It's surgery. What happens is you're shit out of luck. It's bad healthcare. Furthermore, when I work in my operating room, I got my team. I got everything dialed in. I have home court advantage. My tech, my nurse, my instruments.
Anesthesia.
When I go to
everything.
Yeah, when I go to another hospital, I hate it.
You don't feel comfortable, like you're worried, you're stressed because you don't know if the team's. It's not your team. I get it.
So
you're too far. You're too far.
It's far, but I can tell you I've operated on hundreds of patients from the Middle East, Qatar, Kuwait, Saudi, Dubai. And while it is not ideal, I'm not in Wichita, we're in Beverly Hills. So what you do is it's 2 weeks, no matter what surgery I do, facelift, body lift, 360, tummy tuck, every surgery I do is 2 weeks. LA, 2 weeks. 2 weeks. You come to LA, you get an Airbnb, you stay at the Beverly Wilshire, whatever. And you don't have to be wealthy. This idea is, oh, all the people from the Middle East, they're loaded.
Not true.
There's a lot of regular people in the Middle East who are hardworking people. They're not going to stay at the Beverly Wilshire. Who gives a shit? Stay at an Airbnb.
All the way.
Right.
The more when now you have a kid, so you're going to get Airbnbs more and more.
Right. And you come and you stay 2 weeks. You get great care. Now, can you have a complication afterwards? Sure, but it's much less. I take care of people from all over the world. 2 weeks, they leave. If you came to me from Chicago, 2 weeks, you think I'm going to fly to Chicago? I'm not going to fly to Chicago. So what I think is if you can find a surgeon locally, of course that's better. Absolutely better to do surgery near your own home. But if you can't, I wouldn't do a shitty surgery because it's close versus a great surgery because it's far. Definitely not, in my opinion.
You're going to spend on certain things in life. You spend on healthcare and what you're going to, like something that you're going to live with every single day. Like you don't don't keep an out on on your health or your surgery. And this is something.
You're actually very good at knowing all my sayings. So I have a saying, if you pay a lot, you don't necessarily get a lot. But if you pay little, you absolutely get little.
Yeah, I saw
So,
that interview.
right. So the idea is if you don't pay a lot, don't expect anything. Now, it doesn't mean that, oh, okay, so that means if I don't pay a lot, so I'm going to go to this doctor who's gouging me. His facelift is $100,000. Why? Well,
We know what you said.
why? Well, because it is. It's the blah, blah, blah facelift. Listen, he or she may be excellent. I consider myself one of the best, but I don't charge you $100,000 for your mommy makeover. Then I will price myself out of the average person. And I want to take care of the average person, right? So just because you paid 100 grand doesn't mean you're going to get twice as much as someone who paid 50 grand. That's what I meant by that.
So you're basically reasonable. Your prices are considered reasonable for such procedures. You're not like overboard.
No,
Because I get
I mean,
all the time. After
listen,
this live, I'm going to get a lot of questions about price point from you.
Right, listen, so it's all relative, right? For one person, reasonable is another person's outrageous because everyone, for them, finances are different. I know what people charge and I know what things are worth. And I know what I could charge if I wanted to. So if I wanted to work less, I double my prices. I will have half the patients naturally, and I make the same amount of money with half the stress. But I don't get to take care of as many people, right? And I don't get to impact as many people. So I know that my price point is where it needs to be, where I feel satiated, and reasonable people can stretch themselves. If I wanted to, I could make it untouchable. But then I would change the dynamics of who can or can't have great surgery. The goal is for people to have access to great surgeons.
Yeah. Doctor, I know that you started plastic surgery uncensored 2019. I think
yes.
COVID. And that's what I found out about you, actually, because I also started doing my lives during COVID. So tell us more about that. I think we only have 3 minutes left. So let me know why you started this. And I know that people are watching you today, but if they want to know more, are they going to find more of your interviews on this platform? Are you still doing it, or what's happening?
Yes. Thank you for bringing that up. My manager would have kicked my ass. So you can see how I speak. I speak like you're my sister. I'm very passionate. I love plastic surgery. It's the bomb. I mean, the things that I do, the number of cards, gifts, I can't tell you another job where I get to do what I get to do and love it. Having said that, I hate my profession. Why do I hate it? Because it has opened up the doors to all these unscrupulous, horrible, terrible surgeons and practitioners. So my practice is very heavy in revision. Very heavy in revision. I'm seeing beautiful girls. I just saw a girl last week who went to Mexico and just destroyed her body. So I got frustrated with all these bad outcomes and people doing shit they shouldn't be doing. And so I created Plastic Surgery Uncensored, which is the podcast, which is my platform where I get to just be David. I get to be Geraldo or Howard Stern or get to say whatever the hell I want. And in doing so, I try to educate like we did today, like you were so, I think, responsible to your viewers. Yeah, we didn't say anything positive like, oh, run out and come and do this. No, we told them the truth. And people need to know the truth. And so we created that platform, this podcast, where we go over all these topics and talk about A to Z with guests, and we uncover the truth about everything that we touched on and more. Threads, BBLs, breast cancer with implants, machines, revisions, traveling. So you did an amazing job here touching on all those key topics. Now, if you listen to each episode, and there are multiple episodes on topics, it expands. And it's on all the streaming, Apple and all those things. And then there's a live, and then there's a video version of it on YouTube. We record them and we put them on YouTube. And then it's my favorite thing to do, because at the end of the day, I think my calling was to be a professor. I always wanted to be a professor. And that's my classroom, for lack of better terms.
I love that. Honestly, I studied PR and marketing, and my master's is in management, and I studied in Boston. And I went to college very early. So now and then I worked in banking forever, and then I became an influencer, and now a TV host. So it's just very confusing how life has been taking me to different paths. But I personally love dermatology. And if I go back in time, I always say that if I didn't go to college at almost 16, I would have definitely been a dermatologist. But it's just too late now for me. I'm not going to be a doctor now.
Well,
I love it so much.
You're very knowledgeable. I give you great credit. I've been interviewed by many people. You did a great job of doing your homework, guiding the conversation, maximizing your hour. So the people who listen to you for a reason, because you do them justice. Because you don't just come out here and just babble and say a bunch of nothing. It would have been a total waste of their time.
No, of course not.
And you did a great job of
I would have wasted your time. I mean, I know your time is precious. And honestly, you can't imagine how much I'm loving every piece of information. You're the only doctor that came on all my lives that said, you're against plastic surgery, you're against BBLs, you're against threads, and I love that. Threads, all the European doctors are like, they rave about it. American doctors are all against, but about BBLs and lipo, I love your extreme honesty, because I think every woman thinks that lipo is a quick fix, and you just proved otherwise, and I love that.
Hey, listen, it's just one person's opinion, right? I mean, at the end of the day, the beauty of plastic surgery or medicine is it's a practice. We call it practice. So each surgeon is practicing what they believe to be true to them. And the beauty of plastic surgery amongst all other surgeries is it's visual. So a doctor can say or whatever he or she wants, but then you go on their galleries and hopefully they're honest and you see their work for what it is. And if their work is spectacular and they do incredible work, then hey, you know what? Maybe they have a skill set that I don't have, or they know something I don't know. I don't know everything, and nor do I have every skill set, but based on my 20 years of experience, these are the things that I hold true. And this is how I want to take care of my patients like my own family members. So, you know, that's the beauty of it. You have different people with different opinions. That's what's great.
Thank you so much, doctor. Loved having you. And hopefully if I visit LA this summer, I'll be coming, because my husband
for sure.
So yeah, I'll be coming hopefully.
You come and see us. What I suggest is if ever you wanted to do this again.
Yeah, I will do it again. We can schedule like a month or two and do it again. Another topic.
Get a whole bunch of questions from your viewers.
I will for sure.
Just what often is very fun for people is everybody has these questions and you just, you know, rattle them off and we'll just go through them. Susie wants to know this, Jane wants to know that. Obviously
we can do it about the questions I'm getting, and we can do it just about the questions from the people that are actually, I'd love that. I'd love to do this more.
Yeah, I'm available anytime you like. It would be a pleasure. Thanks for having me.
Thank you for being here.
My pleasure. My pleasure. Good office.
This is my husband's office.
Ooh, see, your office is, look, difference between someone who's in PR and is a host and this shit, look at my background. This is my...
So by the way, I just moved here, by the way, and my house is empty. The office is the only thing that's actually ready, because I actually work here a lot and he works here a lot. But my living room is, as you can see, has no furniture yet.
Ooh, I like it. I like it.
I just
so I love it. And if people want to join, aside from Plastic Surgery Uncensored, they can always grab join us on Instagram, and we post things on Instagram at Dr. Rady Rahban.
Okay, great. Thank you so much, doctor. Take care.
Bye. Bye. Thank you. Ciao.
Thank you. Bye.